All right, so starting off my joint movement video, the first joint we'll be looking at is the shoulder joint, also known as the glenohumeral joint. It is a ball and socket type joint, which allows for flexion and extension to the sagittal plane. Also allows for abduction and adduction through the frontal plane, as well as external and medial rotation to the transverse plane, along with horizontal adduction and abduction. And because it moves through three different planes of motion, it is a triaxial joint, which allows it to have 3 degrees of freedom. Then next up is the elbow joint, also known as the humerorulnar and humeroradial joints, which is a type of condyloid joint, which allows for flexion and extension through the sagittal plane, as well as supination or inversion and pronation or exversion through the transverse plane, which makes it a biaxial joint, giving it 2 degrees of freedom. Next is the wrist, also known as the radiocorporal joint. It is also a condyloid joint and allows for flexion and extension through the frontal plane, and then abduction and adduction through the sagittal plane, also making it biaxial and giving it 2 degrees of freedom. Last but not least, for the upper body portion, we have the cervical spine, which also known as the vertebral column. It is also a type of condyloid joint, which allows for flexion and extension through the sagittal plane. It also allows for rotation through the transverse plane, as well as lateral flexion through the frontal plane, making it a triaxial joint, giving it 3 degrees of freedom.